Here's a patient who was presenting with right lower quadrant pain, and per the emergency department, they were concerned about McBurney's point tenderness. And so when we're thinking about that, we're thinking about appendicitis. In this particular case, you can see when we're in the pelvis, our eyes are directed over to the right lower quadrant, not only because of the patient's physical symptoms, but also because you can see there's fat stranding involving the right lower quadrant. That if we look at the normal fat, we can see this clean fat over here in the left lower quadrant, in the mid-pelvis, and then in the right lower quadrant, all of that fat looks quite hazy in appearance. And so that's a sign that there's inflammatory changes going on. And you can see right here as well, there's some colonic wall thickening involving the ascending colon. Now, the important thing to identify in these patients is, well, where is the center of the inflammation? Because the center of the inflammation is usually the offending area. And if we come down here and we can see, we're starting to see the inflammation here, we can see that the maximal inflammation is probably around this area here. And you can see that it's surrounding a diverticulum. So this is actually diverticulitis of the ascending colon. Now, most patients, diverticulitis is actually most common in the sigmoid colon. In this particular patient, there's no real sigmoid diverticula, and the left colon, maybe there's a few diverticula that we can see here and here, but the predominant location of this patient's diverticula are in the right side, and so this patient has diverticulitis. We can actually see here the normal appendix. This is it coming out here and turning around here, and so the appendix itself, you can see, isn't particularly thickened. It's got air in it, and it's away from the predominant area of inflammation. So this is not appendicitis. This is actually just a case of uncomplicated diverticulitis of the ascending colon. You can see the reactive thickening of the colonic wall. Now, even though most patients, the most common location for most patients is in the sigmoid colon, in certain populations, such as in Asian countries, ascending diverticulitis can actually be a more common presentation than sigmoid diverticulitis.